Bye. So in for a bit of a treat because you've got a double act, right? Forget about Ant and Dec. It's Andy and Robert. Robert's the guy who's going to share a lot of really geeky science. I'll tell you about myself. I'm a certified animal behaviorist that works with Pet Remedy, but I've got a human psychology background, so I was involved in human therapy for about 15 years, and I've been involved with animals for about 10. For me, I'm really passionate about talking about the notion of the emotional experience, and I'm going to share that a little bit with you today. Because we've got to start thinking about the emotional aspect of working with animals. But that applies to us as well, right? And you guys in veterinary, whether you're veterinary nurses or vets, or the long-suffering people on the reception, or whatever it is role you have, our own emotional health is really important. And quite often we I find ourselves in positions where we get told things like, oh, we'll try not to get too attached, or try not to get too involved, or guess what, we do get attached. And we do get involved. The problem is when we have that kind of narrative around us, we feel we can't share our emotional story. And actually today I'm going to be introducing some bits about the kind of philosophical approach really to having a perception shift in behaviour. But before I do my little bit, over to Dr. Robert Falconer-Taylor, and he can do his introductions.
Right, good afternoon to you everybody. Did you get these learning outcomes in your documentation? Did you see those? No, probably not. Anyway, we sent them in. We religiously sent in our 500 words, and those were as part of it. But basically, in a nutshell, the first two there are basically Andy's stuff. And what Andy's going to cover, as he said, is he's going to move us away from very much a task-driven industry, i.e. veterinary practice is all about having a pile of clients outside. You have to get the task done and get them through the practice. And what Andy's going to do is give you some really, really helpful tips and hints to turn that into a more care-centered approach where you can try and sort of combine the throughput of the practice with actually taking care of yourselves and of the animals as well. And the bits I'm going to cover are what you see in 3, 4, and 5, which is more for neuroscience. My background is that I am a veterinarian. I've been in practice for ages. For the last 20 years, I focus primarily on behaviour, and I've been teaching psychopharmacology. It's my kind of pet subject, if you like. And it's interesting, and I will tell you now, I've got people that run Pet Remedy in here. They sent me stuff through in September 2012. I know the date because I looked it up before I came to the lecture. And they sent me a load of bump. The company was fairly new 10 years ago. And they said, look, we've got this stuff, and are you interested in having a look at it and perhaps incorporating it with what you do with your education? Because I was in the education side of behaviour. And I kind of ummed and ahed, and I thought it was another one of these homeopathic products. And I thought, well, no, I think I'll kind of pass that by. Time goes by, and 10 years later, I've started working with people like Andy. And I love Andy's approach. So what he's going to talk about is really important. I love his different spin on animal behaviour and animal behaviour welfare, emotionality, and all that kind of thing. And he said, would you like to talk to the guys at Pet Remedy? And I didn't tell him I'd been through that route before. And I said, yeah, sure. So we set up a Zoom. I spoke to them. Long story short, they sent me all their stuff, a lot of confidential stuff about the analysis, etc., etc. And they said, do what you like with it. So I spent the last 6 months pulling it to pieces, looking at the pharmacology, because that's what interests me. And that's what I'm going to share with you today. A few insights from that, a few snapshots of what I've actually found, and what makes me excited about it. Now, the question you ought to be asking yourselves is, am I being paid? Yes, I am. I've been paid for the consultancy work, so that's my disclosure declaration. But what I say is what I believe and what I think about this product. Okay, so from that point of view, that bit's the kind of unpaid bit. If I felt it was absolute rubbish, I wouldn't be here talking. Okay, I've done my bit, I've been paid for that, but I'm here because actually, as a product, it quite excites me. At the moment, I'm writing a book, and part of that is the importance of olfaction in the emotional side, in the emotional therapy of dogs and cats. So it was something that kind of gelled in already with what I was interested in. Okay, so that's really what I'm going to focus on in my part of the talk, and Andy will then do his more philosophical bits in between. Okay, so you won't be bombarded with too much pharmacology this late on a Friday afternoon. Right, Andy,
good. I have the power of the clicker. Right, so before Robert does his amazing stuff. I'm like the warm-up act, really, because he's like Cher, and I'm the warm-up act for Cher. We've got to have a perception shift about behaviour. What is behaviour? We talk about behaviour all the time. And this is often said, isn't it, right? We don't know what animals think and feel. That's what people say. So especially within my community, dog training, we've had a big push towards a very arbitrary compliance, obedience aspect that somehow dogs, cats, rabbits, whatever, have to behave in a certain way. And this has led us to have what in kind of human psychology speak is a very task-orientated transactional approach. So you do this and I'll give you that. Okay. If we're going to start thinking about stepping back and having more of a philosophical approach to behavior, we've got to start asking, why do we have a perception of the behavior that we already have? And that's because in Hale, oh, I'll have to go without note. This is completely unscripted now. We could be here all day. Right, let's see how we get on. This is what, in the, again, human psychology terms, we call the good to bad continuum. This notion that somehow behavior is on a spectrum, okay? So that behavior is good, that behavior is bad, that behavior is all right. And underpinning that is this notion that we must reward the good and punish or ignore the bad. Now, it depends, obviously, if you're kind of progressive, force-free, humane like myself, you see a lot of memes, you know, reward the good, ignore the bad. Now, this seems to make sense, doesn't it? This isn't without question, is it? And this just shows how indoctrinated we are into it, that we don't necessarily question it, because, really important point, if we start asking just a couple of little questions, it starts to make us think about behavior differently. Who decides what's right and wrong or good or bad? What motivates those narratives? If I'm making a decision about your behavior and I've decided that's bad behavior, what am I basing that on? How binary and arbitrary does this become? In other words, I expect you all to behave in a certain way and it's fixed. No nuances, no grey areas. That's my expectation on you. And this final one is so important. What value do those behaviors have? So if I think about the dog then, that somebody has decided that behavior is bad, that behavior is naughty, that behavior is dominant. What behavior did that, what value did that actual behavior have to that animal in the first place? And more importantly, if we're going to start changing behavior, what behavior does the behavior that I've now replaced it with, regardless of the methods and tools, because we have big arguments, don't we, about punitive versus positive. I call it the operant merry-go-round, because everybody's arguing about the best way to do task. Those new behaviors that I've created for that animal, what value do they actually have for them? Oh, I do have my notes there, good. Let's just so I can see what's coming next. So this is really important for us then. When we start thinking about behavior, there's two things about us humans. First of all, we're really judgmental, because our brain's designed to be that, right? And secondly, we hate to be judged. So if I was to pick on my colleague Jill here, because I can, and I made a judgment on Jill's behavior, Jill could quite rightly say to me, Andy, you don't know what kind of day I've had. You don't know what I'm dealing with at the moment. And this is where we start thinking about the nuances behind just the labeling of behavior, which is what we tend to do. So I like to look at things then through the emotional experience lens. And it's a really powerful one, the emotional experience lens. Two things about the emotional experience. First of all, we all have one, right? So even those who will say, well, we don't know how animals think and feel, they will, and some people do it begrudgingly, at least accept that they have an experience of sorts. But we all have one. You have one, I have one, cat has one, dog has one, horse has one. But the next thing is the most important thing about the emotional experience. When we start thinking about working differently, it's unique to each of us. So I don't know how you think and feel as individuals, right? So should I ignore that and just make you do stuff based upon my version of what's right or wrong, good or bad? And this is when we start to really move away. It's a paradigm shift. It really is about how we feel and view behavior. A lot of the stuff that I talk about, there is a huge mirroring in the progressive side of educational psychology and development in children as to what we're thinking about with animals. And I want to share this with you. So, wonderful book, if you're interested in this stuff, called Molecules of Emotion, by Candace Pert. Candace isn't with us anymore, but she is a dyed-in-the-wool scientist. She's a neuroscientist, neurobiologist, I think is a better term. And she found the opioid receptor. I don't know who lost it, but apparently she found it. And it's a great book. And she's died in the wool scientist, right? But she says this really profound thing that really hits me when I think about looking at behavior differently and recognizing how important emotionality is. Science often will not concede something exists unless it can measure it. That which cannot be measured is often referred to as non-things. So if we can't put it into a test tube or put it in a Petri dish or somehow measure it on some kind of metric, it's a non-thing. However, the issue for the individual is that the non-things are often everything. And actually, this way of thinking about emotionality, thinking about stuff, is recognizing that we all have a truth. We all have an emotional truth that underpins our individual care and support needs. And it's about us being better able at trying to be available to the truth of another. This happens to be a dog or a cat. But most importantly, when we think in relation to what Robert's going to talk about, and also the brand as well, how do we have a nod to that experience of the other? How do we try and support that emotional experience of the other? And this is the shift that we have to think about when we think about behavior, because rather than just thinking of behavior good or bad, when we think about behavior through the emotional experience lens, we start asking a couple of more fundamental questions. Behavior is an expression of need, the need for relief. In my opinion, the two most important words in the psychology of behavior is safety and relief. We all want to feel safe, right? The most important word there is feel. And if you have any elevation through physical pain, emotional pain, whatever it is, we want relief for that. And we express that through our behavior. Behavior is especially for connection and safety. So all these dogs then, we've decided, I'm saying dogs, it could be cats, rabbits, and things, but dogs is my bag, if you like. And especially because there's so much misrepresentation about dogs out there. You know, all the crap stuff on telly, it just drives me nuts. Because how many of these dogs who are behaving badly, to quote the title of one of these shows, are actually trying to communicate pain, trying to communicate emotional need. But also, behavior is an expression of self. I wrote an article recently, a piece called Whose Behavior Is It Anyway? So whose behavior is it anyway? I think behavior for the individual is just as important as the clothes we wear and how we have our hair, right? There's so many things that we have as a behavior, as an expression of self, identity, worth, and personality. As a member of the LGBTQ community myself, I'm married now, wonderful husband, great. Growing up in the 70s, I'm older than I look. Growing up in the 70s, somebody else had decided on that good to bad continuum that how I needed to express myself to feel safe, how I needed to make safe social connections, and ultimately how I needed to find somebody to love, somebody else had decided that was inappropriate and bad. So it really starts to give us a chance to step back. Our brain is designed for that quick thinking judgment based on our own little belief system. We have to allow ourselves just to take a breath and think, right, this dog's really pissing me off. This dog's really embarrassing me, whatever it is we're going through, but I just need to think about what it is that they might be experiencing right now. So behavior expression of need, behavior expression of self, even if I turned up with a positive toolkit using food, am I providing relief for an animal that they've been trying to communicate, or am I just getting them to do something else instead? And we think about this within the veterinary setting, of course. It's very easy with food to get an animal to tolerate something in the moment, but is that experience any improved for the next time? So back to Candace Pert again, why not? This is the importance of recognizing emotionality. I've only got a couple of minutes to kind of go through this, but this is a huge talk on its own, talking about how we have a new perception of behavior. But to really get the value of what Robert's going, we need to think about behavior differently. And we need to recognize that emotions are not some wishy-washy, inconvenient thing. They are fundamental to us. They're a call to arms. How you feel is designed to make you seek relief, seek safety, find something that you need, water, food, whatever it is. And I love this here, when emotions are repressed, denied, how often with these wonderful animals who are seeking safety and connection, are we denying their ability to be able to self-regulate? Because we've decided through the good to bad continuum what it is they're expected to do or not do. And we've got a crazy situation with the general public now. They've been convinced that the most important thing in the case of dogs, the most important thing is to have a well-trained, obedient dog. It's causing huge problems because if everything is looked through an obedience lens, we have a situation where the general public know how to teach sit, but they don't know what pain looks like. They can't evidence-based pain to you. They don't know what stress looks like. They don't know how body language works, how animal communication works. My own community are failing us with dog training. A lot of these animals that struggle in the veterinary practice, we should be supporting them early on in that first 12 months when the brain is looking for ways to be better at self-regulating. All the stuff we're putting into that brain has little use or value to the dog. It's mainly for us, right? Sit down, come stay, etc., etc. So good progressive trainers understand this. The training can come later when the brain is more formed. All juvenile social mammal brains are designed to dysregulate. So we're trying to shove a lot of expectation onto a young brain. The most important thing I want from that young dog is to know that it can feel safe with me, that it can learn in an experimental learning way safely and also make mistakes during that learning, and also be well equipped to regulate well in stressful situations like the groomers and the vets and all these kind of things. So this stuff's really important. So this brings us on to this thing then. We have adopted a very task-orientated transactional approach. And we need to start thinking through this emotional experience lens and having more of a care-orientated approach, which is more relational. Now, if you just do task, it doesn't mean you don't care, but the more you focus in on task, the less you can care. My husband's an end-of-life nurse. By the way, he works in a hospice. A lot of people think, oh, that's one of the toughest jobs, right? I've got amazing vet and vet nurse colleagues. My husband said he couldn't do your job. So I just want to put this into context, right? He couldn't do your job. They're always under pressure to get tasks done, because that's what we are, right? And we have to, there's a lot of what ifs, so yeah, but you know, time and this and that and the other. Those are really important questions, but they shouldn't be the barrier to us trying to think about more inventive and creative solutions that we can have a more care-orientated approach. How do we bring more care in rather than just trying to get tasks done? And that's where we all need to discuss, my community, your community, we need to come together and think about things. So this is the end of my little bit, but I just want to put this to you then. When we start thinking about things differently, this is the question that I see a lot in veterinary circles. Is it pain or is it behavior? Based upon this kind of paradigm shift of looking at things a little bit different, I don't think that's fit for purpose anymore. I think the only two questions we have to ask is there physical pain and discomfort, or is there emotional pain and discomfort? Both are equally valid, both need treating, and both are interconnected. And this is the thing, you see, because when we start looking at stuff, there's a lot of discussions I have with my veterinary colleagues, a lot in the behavioural world as well, recognising that both of our worlds, there's many of our old practices that aren't fit for purpose moving forwards, because we recognise how interconnected everything is. Oh my God, there's so much stuff, right? The emotional stuff, trauma, neurochemistry, biology, gut-brain access, blah, you know, so much stuff, right? So for me then, when we recognise, one, we've all got to work together. We're all part of the same hub. Myself, my veterinary colleagues, my physio colleagues, my training colleagues. We also have got to start thinking about how do we stack the cards in our favour a little bit then, because it's okay me judging that dog or cat's behaviour and thinking about, I've got to get my task done, but for that dog or cat, they will have a lived experience underneath it. How do we try and just get that balance? And this is where the product can really help, which Robert's going to talk about in a minute. So as I say, both are equally valid and worthy of treatment, and they're all interconnected. That's a little bit of a philosophical hit to start with, right? I'm going to hand back over to Robert now, who's going to deep dive you into some of the neurochemistry around the product, but hopefully that's given you a chance to think, maybe behaviour is a little bit more nuanced than just good or bad, right or wrong. Right? Thank you, Robert.
So the question is, what makes behavior, or more importantly, what makes emotions? What turns chemistry and neurons and molecules into something we can actually feel and think? Okay, so this is or represents or is the ingredients of Pet Remedy. There are just 4 things in it. It's not one of these products that's got loads of stuff in it. It's been like this ever since I first looked at it over 10 years ago. It's been the same stuff. And one of the first things that struck me as something really positive about this is that all these ingredients are sourced specifically from particular places in Europe. They all have good provenance, we call it, i.e. they've got a backstory. So it's unlike a lot of the kind of things that you might buy that have been formulated by some third party, and you've really no idea where a particular botanical might have come from. if you bought it in bulk from somewhere in the Far East or something like this. So I think for me, the provenance of this is really important because that means the ingredients are important. And as somebody who has a special interest in pharmacology, my special interest is in sort of knowing we've actually got the product in the product, if you like, the right molecules in the product, and then what these molecules do. So if you want to walk out of this session now, just with the pharmacology, this is all the slides you need to know. Okay? This basically summarizes everything you need to know about pet remedy. And if you have a look on the right-hand side, we've got our 4 ingredients in the middle there. On the right-hand side, we've got all the receptors, everything these things do inside the brain. So we've got all your favorites, your GABA, we've got your serotonin, we've got your dopamine, antioxidant. You might think that's a bit of a funny one, but I'll come to that and tell you why that's important in a little bit. And of course, we've got acetylcholine as well. Now, you're probably not used to seeing that in a calming product. You're probably not used to even using it in veterinary practice, except within the context of something like myasthenia gravis, or if you're treating a cat that's been had too much flea stuff put on it, and it's sort of shivering and shaking because it's got toxicity. So what I'm going to do to try and describe this to you, because pharmacology is a really difficult thing to teach, is to just step back a little bit and peel things down to the simplest form that you can actually think of. On the right-hand side of this slide, what you've got is a tiny, tiny little piece of a brain that's smaller than a grain of salt. If you dropped it on the carpet here, you'd never find it. And that has about 613 neurons. And each of those neurons is connected to about 7,000 to 10,000 other neurons. So it's deeply, deeply, deeply interconnected. How many connections are there? I have absolutely no idea at all. So what I've done to try and describe how this works and why it's important for you to understand it is to give you a diagram on the left-hand side there of the simplest possible functional unit of a piece of brain that you can possibly get. And so what you see there is, at the top there is the glutamate system. So you've got one glutamate neuron that's sitting there right in the kind of middle of all these. If you work your way around clockwise, you've got down the bottom 5-HT, which is serotonin. You've got noradrenaline, dopamine, histamine. That's important as well, but I'm not going to talk about that at all. And of course, acetylcholine. And the red bits, the red blobs, are GABA neurons, either interneurons or medium spiny neurons, wherever they happen to be. And they kind of sit in the middle of all that mix, so within that kind of cushion or sandwich, if you like. Now, if we think of a supplement, remember I'm doing things to its absolute bare minimum, simple as possible. Think of a supplement. It might be Pet Remedy, it might be anything, it might be a phenobarbital or whatever it happens to be, which binds to a GABA receptor. Just one molecule, a couple of molecules of the supplement binds to a GABA receptor. What you can get in this really simple circuit is about 1 million different ways that circuit can work. Now, you may think that's a number I've just drawn out of a hat, but it isn't. That's a fairly conservative number of different interactions you can get in that circuit from just that one receptor being triggered, that one inhibitory GABA receptor being triggered inside that little circuit. And I'll explain why in a couple of minutes. So the point of that slide, that very, very simple slide, as simple as you can possibly get, is that what that does is it makes this leap, this translation from molecules, from neurons to chemicals, to what we call behavior and emotionality. And if you have a look at the image of these dogs, the little dials on the right-hand side there are sort of waving backwards and forwards all over the place. This represents the kind of arousal level between normal, between subnormal, and between over-aroused supernormal. And if you have a look at the images of the dogs on the left-hand side there, look at this guy here. What do you think his kind of arousal level is? He's sitting there stoically. His behavior is completely inhibited. He's unable to think for himself at all. He's certainly working to task. He's doing what his owner prescribes for him. This is an image of a dog that I took in Eastern Europe, and he sits all day in the pub there, and the owner's got the shock collar sort of operator, the little button on the counter there, and if the dog moves, the dog gets a shock. This dog is completely shut down. Compare this dog with this one here. Huge arousal level. This is a dog being transported in rescue. Look at the whites of the eyes. Look at the dilated pupils. Hugely stressed, obviously stressed. And then you look at these guys here, really happy. Their arousal levels are at different, are in different emotional spaces, if you like. And those are represented by the dials there, down there on the bottom. Now, within all those behaviors, within all those kind of emotional states, within all those interactions with those neurons, we have these other things that we have to deal with in practice all the time. You know, pain is now a big thing of the last 10 years that are people like Daniel Mills that have really kind of published a lot and brought into the forefront the importance of pain as a driver of misbehavior, particularly aggression in dogs. But then there are other things like problems. How many of you see dogs with chronic gut problems in your practice? Really, really common. But it's not necessarily the gut that's the problem. It's the gut microbiome and everything else, but it's all part of this being chronically anxious. It's a good indication that there's something not quite right going on in that dog's life, probably at home or out in the environment or wherever it happens to be. Chronic pancreatitis, underdiagnosed. There's some beautiful work that was published a few years ago that basically shows, this is from post-mortem studies on dogs, that dogs that have never shown any signs of pancreatitis during their lives, but they've actually got grumbling, quite severe pancreatitis when you look at them post-mortem. So it's another one of these things we need to think about, where we have a dog that's suddenly has a change in characteristic behavior, and we're looking for something, because of course dogs can't tell us that they just feel kind of grumbly sick, they've got a bit of a stomach ache, it's that nasty visceral gnawing pain. And then the more obvious things, fear, anxiety, separation, anxiety, etc., etc., etc. So these are all factors that kind of feed into this. And the take home of what I've talked to you about so far is this. Psychoactive drugs are incredibly unreliable. How many of you have prescribed Celgin, selegiline, clomipramine, clomicalm, fluoxetine, all these kind of things? You use supplements. How reliable have you found they've been? Probably not that reliable, yeah? A lot of them don't work. Sometimes they work. You're never quite sure how much they help. But if you think, or you compare that with something like, I saw the Vetmedin stand downstairs, pimobendan for congestive heart failure, you would be really surprised if that didn't actually help a dog. Robenacoxib, a cat with severe arthritis, you would be very surprised if that cat actually didn't have a much better quality of life on medication. But that's not the case for psychopharmacology. And this is across the board. And the reason it's not the case is simply because nobody understands how this circuit works. The idea that we have some grasp on this is actually false. The 1990s was the decade of trying to understand this stuff. It was called the decade of the brain. And many, many countries all over the world spent billions and billions of dollars putting work into research to try and find out the link between the neurons, the chemicals and the molecules, to how that translates and turns into feelings, because they wanted to understand how mental illness works. But they haven't found anything. All they've done is generate vast quantities of data. They're still doing it now, and we still don't know how it works. So you don't have to beat yourself up when things don't work. It's simply because if you're using a product of some sort, whatever that might be, it's probably because you're not tackling the right bit of the circuit at that particular time. But things kind of shift on. So it's one of those things that something might not work now, but it might work perhaps in a week's time, or when the animal's gone through some kind of emotional or behavioral transition, or perhaps just feels less uncomfortable if you've got the chronic pancreatitic dog or whatever it happens to be. So it's not that they don't work, it's more because they're not targeting or tweaking the system in quite the right way. Okay. I think that fade out is back to Andy.
Oh, okay. Well, yeah, this is just a very quick one, actually. Robert's going to continue on with his thing, but when we start thinking about the emotional experience, right, and especially for the individual, about the two things that are really important for that individual to try and find a way of self-regulating. And by the way, self-regulation is not innate. We have to learn it. And we are obsessed with structured education as a species. That's why we put kids through school, right? When I was involved in human therapies, the number of stories that could go back to the trauma of school that ends up kind of translating into when we're adults. Mother Nature is more focused on experimental learning and about how we learn to do things so we can be better at self-regulating. And that's what we want to do as adults. The part of the brain that helps with self-regulation for us humans comes online in our early 20s. I think in dogs it's end of adolescence, is it? So anyway, this is important. So for me then, the two most important things coming back in, just to kind of keep it nice and simple, is how does the brain process what's going on and what does the nervous system do? So I have my little brain, doors of the brain analogy. So if you imagine the brain has lots of little doors in it. I'm thinking animals now, but the same applies to us. We need as many doors open for that animal to have a chance at safely and calmly and rationally processing what's going on and have a chance to regulate that system. Pain, trauma, and stress are big door closers. They are for us, right? If you're very stressed, if you're very tired, which I'm sure some of you are, we have less doors open, so we can't process so well. If you're more sensitive, I work almost exclusively with dogs that I class as dogs that struggle to navigate the social environment. That's my way of saying what most people would class as a reactive dog. But actually that dog is getting overwhelmed because they're more sensitive. And if you are more sensitive, you need more time to process what's happening. So that's the doors of the brain. Thinking about the stress system, I like the good old bucket analogy. Has anybody else heard about the bucket analogy? It's a good one, right? Some people, but I love it because it's non-judgmental. So the bucket is the nervous system. The water in the bucket is how much stress that nervous system is elevating and how much that kind of nervous system engages. In the bucket, elevation, out the bucket, decompression. That's how I like to keep it. These are great analogies for me when I'm working with my clients because they can visualize it, right? That's why I like talking about relief, because we all know about what relief feels like. Yeah, I need relief. The fuller the bucket, the less doors you're going to have open, the less chance of a mindful, rational, regulated response, more chance of a dysregulated, and this is the really important word, reflexive, in other words, automatic. So we can all say and do things in the moment when our bucket's too full, right? It's a great one when you've had arguments with the partner, right? Because I'm sorry, dear, my bucket was a bit too full. Because this is the point, though, it's no different for the animal. So when we're thinking about some of these things then, we've got to think about how do we keep more doors open? How do we get that nervous system to regulate better? So many things are affecting that bucket. The bucket is non-judgmental. Nothing fills the bucket more than excitement. Anybody got any little kids under 6? Here, yeah, or you've had them in the past, maybe they've grown up. Yeah, little kids, right? Their bucket fills pretty quick because remember, their brain's designed to dysregulate. That's the point. Same with animals. So this is important for us when we start thinking about the neurological side of things and also the supportive aspect of thinking about these things, and especially how my industry, my community needs to think about how do we better prepare animals so that their bucket isn't too full by the time they come and see you guys. But again, this comes back to, do you know what, behavior is complicated. How do we stack these cards in our favor so we have a best chance as possible to keep as many doors open and stop the bucket filling too much? And again, this comes back to the product and also some of the neuroscience. So back to you now, Robert, I think, and we can reference those.
Right, I'm going to frighten you with the GABA receptor now. Okay, so basically the GABA receptor is something which is made up of 5 proteins arranged in a circle, and what happens when the GABA receptor works, i.e. GABA, the molecule, binds to it, is that it opens up that pore, it opens up these proteins, and chloride ions can basically pour in and hyperpolarize that neuron, which ineffectively inhibits it. Now, if that was all there was to the GABA receptor, it would be really, really boring. And the reason I said that there are over 1 million different ways that little circuit could work is because of the GABA receptor. And the reason for that is because the GABA receptor has a system whereby each of the proteins has a different combination of receptor types on its surface, which are called allosteric receptors, okay? And what that means is that the GABA itself basically binds to beta-1 and alpha receptors on the top there, on the right-hand side. And what that does is then open up the pore. But what happens beyond that is that there can be other molecules as well, which are themselves non-neurotransmitters, which basically bind to other binding sites. And what you can see here is that I've put a benzodiazepine molecule in there, and what the benzodiazepine molecule does is that it only works when there's GABA already binding to the receptor. So you've got to have 2 GABA molecules bind to the receptor. Then a molecule like benzodiazepine can actually then have its effect. Benzodiazepines bind to the alpha receptor or a gamma receptor. Now, the interesting thing about benzodiazepines is that the reason they're addictive is because they bind specifically to the alpha-1 receptor. And that's what causes the addiction, because the alpha-1 receptors are located inside the reward pathways, inside the striatum. The difference between benzodiazepines and valerian, the valerianic acid, within Pet Remedy is that Pet Remedy actually binds to beta-2 and beta-3. Now, the interesting thing about that is that the beta-2 and beta-3 receptors are located in the same kind of areas of brain that the alpha receptors are located in, which tends to be fairly specific. They're not just scattered all over the brain, willy-nilly. Different kinds of allosteric receptors are located in different parts of the brain. And that's basically how evolution has organized it. What it means is that where you need inhibition, which is anti-anxiety, you get more of the kind of receptors which basically have alpha and beta isomeric receptors on them. And so it simply means that when they get engaged, you then get that kind of anxiolytic effect with these allosteric modulators. And it kind of brings me back to this. And it's because of the allosteric, or the many allosteric binding sites in the GABA receptors, there are about 500 million of them just for GABA, that I can make that claim that there are over 100 million, or 100, or at least a million different ways that circuit can be activated. Okay, so that shows where the complication comes in. So what does that mean in terms of how these things work? This is for valerian, and I put the GABA receptor, at least the mechanism of the GABA receptor up there. And this is what I meant about being really specific. What happens is that these receptors are engaged in very specific parts of the brain, which are dealing with particular kind of emotional experiences, arousal and that kind of thing, which is why they're anxiolytic. The other thing it does is that it also blocks reuptake of GABA itself, so it works a little bit like an SSRI, but it's GABA instead, and so it can recycle, or at least slow down the recycling of GABA and just keep it around a little bit longer. And the other interesting thing it does is that it also acts on serotonin receptors, particularly serotonin 5-HT5A, which is a useful one to know, because one of the things that we talk about in veterinary medicine and in veterinary behavior is that dogs basically don't get enough sleep, and cats as well. They need sort of safe places where they can actually get good quality sleep. And what this receptor does is that it resets the circadian clock. And so what it does is help dysregulated sleep become much more regulated. And I've depicted that with that little sleep spindle there, because it's the sleep spindles which are indicating this kind of alpha burst within the delta wave of non-REM or slow wave sleep, which is really, really important for consolidation of memory. So if you don't have good sleep, then you're not able to remember things very well either. And so, it compromises your ability to be able to cope with everyday life. The whole point of everyday, coping with stresses and strains of everyday life is that you actually learn to cope. If you're not getting enough sleep, that is then compromised. And what I found interesting about this product is that it's got the ability to actually regulate and modulate that particular pathway in the brain, way beyond GABA. That kind of points that out when I come back to it a little bit later on. This is clary sage, so it has no effect on GABA at all, but what it does have is antioxidant activity. And if you think about the dogs and cats you treat with chronic liver disease, what kind of medication do you give them? Antioxidants. So what this does is stabilize membranes and actually help tissue repair. And it's interesting that clary sage and a couple of others actually have this antioxidant effect as well. And it also has some effect on the dopamine and serotonin system too. Sweet basil, kind of the same, antioxidant. This is one of the ones where acetylcholine comes in, which I found interesting. And what it does is that it modulates acetylcholine, particularly in the circuits in the prefrontal cortex around kind of memory and making sure that memories are saved and stored properly. And so what it does is kind of aid in animals being able to remember, which is basically how they go about making decisions. You've got to have that kind of that bank of previous information and experience in order to be able to make effective decisions. And also it has effects on regulation of serotonin and dopamine on the right-hand side there. Lastly, vetiver here, again, no effect on GABA, but this also, as well as antioxidant, also has anti-inflammatory properties. And as you probably know, most disease, not just medical disease, but psychological disease as well, is considered to have its root in inflammation of some sort. So all diseases now are considered to be inflammatory in origin. So there are active ingredients which will prevent and modulate, downregulate the inflammatory cytokines that you get with damaged tissue and stress and all that kind of thing. The other one here is this neurotropic effect, which I found quite interesting. Some of you are quite young in this room, much younger than I am. Did any of you ever take Ritalin or methylphenidate to help you get through your exams? No? I know lots of people who have. And basically what that is a nootropic, and what it does is basically make you much more focused and much more able to have better working memory and so on and so forth, and keep you solidly focused on things. And I found it interesting that this particular product has also been shown to have that kind of effect. Right, so what does this mean? You've probably noticed that in all the slides I've shown you about the product, what I've had is this yellow box on the left-hand side here. And what it's doing is actually giving you an indication of the kinds of behaviors that you can rely on which indicate an improving quality of life for that animal. Now, where these numbers come from is basically a fairly big review that was done across medics and also veterinarians of how they defined the difference between something which was anxiolytic and something which was sedative. And the point of this box is to show you that the indicators on the top here, all of these things, increased sleep latency, increased sleep duration, increased rest behaviors, decreased hyperactivity, decreased hypervigilance, all these things here are really, really poor indicators of either anxiolytics or sedatives, i.e. you will see those kind of behaviors in both. If you're looking for the kinds of behavior that you can rely on to say, yes, this dog, this cat is actually feeling better, this dog, cat is less stressed, you need to be looking at these kind of behaviors here. And it's all the things which in actual fact might be quite negative. Increased exploratory behaviors, increased play behaviors, increased social behaviors, i.e. the dog's jumping up when people come into the room again, barking at the window at people going by, increased appetite, increased cognitive function, approach avoid, more likely to approach than avoid, okay? How many times do you hear people make claims about a product which reduces a dog's barking by 50%? A lot of advertising material you see on a lot of products. But what I'm saying here is, in actual fact, a dog that barks at people going by, past outside, if that barking increases as part of an overall dog's kind of overall improvement of the dog's lifestyle, that's actually a good indicator that that dog is actually feeling better. So barking itself is not a good indicator. We've got to think much more nuancedly about what we're actually looking at and whether these behaviors are performing some kind of useful function, which is what Andy was talking about, for that animal to get some kind of reward, some kind of pleasure out of life, which may not, of course, be the kinds of behaviors which are necessarily appropriate for the owner. But of course, that's not for the owner to simply suppress those, it's to actually redirect that animal's behavior in a different direction, okay? So I think this is a really, really important slide.
Yeah, and I'm just going to come in very briefly on this because if you want to press the button again.
Right.
Yeah, thank you. I've got an assistant now. This is why I come back into the emotional experience again, right? Because something that Robert said actually, which is really important, especially for veterinarians, is recognizing that something like a benzo will attach to a different receptor to what the product pet remedy does. And that's very important because benzos are used a lot, of course, with animals that are experiencing high levels of anxiousness or fear, and they tend to be used in a very targeted way and in a very short-term way because of course of the addictive element to it. But a lot of animals then, they have a cliff edge, don't they, because they get taken off the benzo. We now know, because of the science that Robert's introducing, that the pet remedy can be used alongside these products, these other kind of pharmaceutical products. They work well together. This thing about the emotional experience again, though, and especially when we think about trauma, we've got to start allowing more doors to open. We've got to drain the bucket, and then we can see what we have left and not start looking at behavior again through that good to bad continuum. And taking a trauma-informed approach is a really good example of this, because I work a lot with deeply traumatized dogs. So when I first start working with them, there is hardly any behaviors because there is almost a natural sedatory element through the trauma. Then one day the dog starts barking at the postman or starts barking at the next door neighbors. And I think, yes, this is brilliant, because it shows the brain is starting to feel safe to communicate now. If we were just looking at that through the good to bad continuum, we're like, oh, that's bad, because it's barking, right? And I'm thinking, no, this is great because we're opening doors now. When I start introducing the product to a lot of the dogs I work with, we start to see a shift in their behavioral presentation. And sometimes on the good to bad continuum, some of that behavior might be seen as bad, but I just think this is a dog who's feeling a bit more confident. This is a dog with more doors open now. This is a dog who's more present. Now we can really help to identify what it is that that dog needs from us from a point of view of behavior as an expression of need, behavior as an expression of self, and support it. So this is really important what Robert's sharing with us now about thinking about how we have the difference between what is an anxiolytic, true anxiolytic, and what is actually a sedative. It's very easy just to want to sedate something because it's just the ultimate way of shutting down a behavior, right? Thanks, Robert.
Okay, I'm going to skip over those slides because you know all about palatability, you know about the challenges of actually getting a product from the mouth through the stomach, absorbed, hepatic portal vein to liver, liver metabolism up to the brain. You know all those kind of challenges, so I'm not going to go through those with you. The only thing I'm going to show you here is that one of the things I like about Pet Remedy is that number one, it overcomes the problem with palatability. Number two, what very few of us know about is that there is another route directly to the brain via the trigeminal nerve. So if you inhale something onto your nasal epithelium, some of that product will be absorbed and can be transported up into the brain via the trigeminal nerve. And it's a very short nerve, and it's surprising how quickly it can get in there. And you've got the olfactory nerve as well. So this is still a pharmacological mechanism, but it basically bypasses the gastrointestinal tract, bypasses liver, bypasses the blood-brain barrier directly into the brain. And the other thing is, of course, is the olfactory side of things, which is non-pharmacological. So we've got a pharmacological mechanism, which is inhaled through the nasal epithelium, bypassing stomach, et cetera, but it still has to go through blood-brain barrier. Pharmacological, i.e. it goes onto receptors that I described, and we've got this olfactory route, which is completely separate, because what happens here is that the product is binding to olfactory receptors, and then that information is being translated electrically and then conveyed to the olfactory cortex. So it's a bit like touch. Touch, if you touch the skin, that's turned into an electrical signal, and that feeling is then passed up into the brain and then translated. So what interests me about Pet Remedy is the fact that it's engaging the olfactory system. And so that's what I'm going to talk about now. I'm not going to touch vomeronasal organs and pheromones at all. I could talk to you for ages about that, but I'm not going to because it's not in Pet Remedy. Pet Remedy basically binds to regular epithelial nasal receptors. So this is what I find interesting about this product. What we have with it is a system where rather than just giving something intermittently, you've got it in the air all the time, so the dog is breathing it all the time. The owner is as well, by the way, which is interesting. And a lot of owners seem to have an effect on themselves with it as well. But basically what we have is this ongoing connection between associative learning, because olfaction is a learning signal. You learn from smell very, very easily, and basically building emotional resilience. And the way that happens, I don't like the word calm. I like the word building emotional resilience, because what that means is the animal's learning to cope better in a particular environment, in a challenging environment, which for you needs to be the veterinary practice, the veterinary surgery. You want to help animals cope better in that environment. And what I've done is I've split this up into three different interfaces. So there's an emotional limbic part, there's a social part, engaging oxytocin, and there's also this part, this interface called the environmental adaptation. So what is the emotional part? The core of this system is learning. Decision making is learning and making better decisions. And that's what that is, orbitofrontal cortex. This connects up through the limbic system. The olfactory system is intimately connected to the limbic system. Smell is a really important emotional experience, as you know. You can think of smells, they bring back memories from years back, a particular smell. So it's something hugely important for emotional learning. We've talked about trauma. We've talked about the idea of good things and bad things happening to the animal. This is a kind of balance between nucleus accumbens, the reward pathways, and also the amygdala, which is for processing more emotional signals, and also for salience, i.e. importance. It's not necessarily all negative. So we've got this approach-avoid thing again, which we talked about when we were talking about anxiolytics. Approach-avoid. Is this good or is this bad? And part of that system is hippocampus, entorhinal cortex, which of course is about memory and memory consolidation. And again, this brings us back to those 5-HT5A receptors and sleep, and the importance of trying to get the dog back, or the cat back into a good level of sleep each night. So they can consolidate those memories and then make the best decisions to help them build emotional resilience. The final thing, that's just to remind you, or bringing you back to this, about the specificity of these receptors and also the importance of 5-HT. The final one is this. Scattered through the, no, right, okay, I've missed a slide there somewhere. Oh no, there it is. There are lots and lots of oxytocin receptors in the olfactory system. And what those do are, you heard of the Panksepp's care system, touch and feeling, social relationships and so on and so forth. The reason for that is because smell is hugely important for social signaling. Maybe not so much in us, but certainly in animals. That's been shown to be the case in humans as well. So the idea here, the way I see Pet Remedy working, is that if you've got the smell of Pet Remedy in the atmosphere, the smell of Pet Remedy at the dog's home, the smell of Pet Remedy at the surgery, there's this kind of continuity of transfer of dogs' ability to be social around not just the owner, but also around veterinary staff at the practice too. So the idea is that you're building into that dog's memory this thing that this is a safe place to be. Even though it can be a bit scary, the dog, it builds this emotional resilience to help the dog cope better in those kind of environments. The final one is a really interesting one, and this is the environmental one. All of you have at least 2 olfactory landscapes. You've got your olfactory landscape for at home, which is the cooking smells, the baby smells, the smells of paint, if you paint your house a lot, cut grass, etc., etc. Those are lots of nice, comforting smells. At work, the smells are very different. It tends to be a disinfectant and autoclaves going and poo and vomit and all those kind of things that you're faced with all the time. And the thing is, they're interchangeable. If you went away on holiday for 3 weeks to Bognor or Bahrain or somewhere like that, where the smell landscape was completely different, your olfactory receptors would change completely. This isn't habituation. You actually start using different olfactory genes, and they are then programmed and placed into your olfactory epithelium that replace the other ones. So it's this complete, what we call a representational shift. And the reason for that is because olfaction is a very complex modality of sensory stimulus. It's not like vision. You only learn to see once when you open your eyes in those first few months when you're a baby. Because vision is really simple. It's all about angles, it's about edges, and it's about shades and colours. And so it's something that's the same all the world over. But that's not the same with olfaction. Your olfactory landscape is different wherever you go in the world. And so the olfactory system has evolved to go through this kind of adaptive change. And for me, that's really exciting, because what it means is it then gives us this other opportunity to have this consistency of the smell of Pet Remedy product at the home, in the kennels, in the vet consult room, in the waiting room, where you've got this continuity of some kind of consistent landscape that basically gives the dog or the cat a safety signal. And I think this is why it works so well. We've spoken to a lot of people on the stand who say that it really does work well for them in the practice. It's not because of GABA, in my opinion. It's actually much more because of this and these other things that I've shown you. This kind of consistency and the animal building up this emotional resilience around the product. And so to sum up, multimodal mode of action. We've got the pharmacological, which is much more reactive. Owners want a quick fix, which is a reaction to what the dog's doing. But where I see Pet Remedy's place come in is this much more proactive approach here, where we're actually doing something in the background all the time for that animal, for that animal's experience, which then builds up this emotional resilience. So I've run slightly over time, I'm afraid, so I've kind of rushed through that a little bit, but that's the kind of gist of it. Was there anything else you wanted to add?
No, really. I just think this comes back to what I was talking about, stacking the cards in our favour, right? And I think using a product like Pet Remedy, and one thing that we're really kind of humble about as a product really is that we recognise that some animals do better with something else, and that's fine. Because like Robert was saying, even with this pharmaceutical stuff, it isn't always the right thing, and we've just got to make sure that we're doing the best we can to support that emotional experience of the animal. And something as simple as this product, but also there's an extra psychological component for me. Because if a caregiver, if an owner has a product in their hand that literally says on the tin, this supports my animal's emotional well-being, it really helps them with that perception shift. And the thing about task and care, when I first meet a client, they're stuck in task, right? the task being get my dog stop pulling, get my dog stop barking. This is why people do use a lot of aversive tools. Doesn't mean they're not a very nice person. It just means that they're stuck in task. But the other thing I know is that they really care. And Rob was talking about Panskep's care circuits. I want to activate those care circuits. I want them to recognize their animals' care and support needs. And we all have a job to do with that, whether it's the physical care and support needs or the emotional. And this comes back to the product again. It's about how do we stack those cards in our favor a little bit. And it can make a huge difference. And that's why we see a huge difference. And it's used with my colleagues in rescue for the same reason. It can have a really quick impact on that brain neurochemistry that you're talking about, Robert, sometimes. But also it has that connective element. Great, good. I hope that was informative, especially Robert's stuff. Thank you. We're going to make this available online. On the Pet Remedy thing, so especially with all the slides and stuff, if you want to listen in again. But if you've got any questions you want to ask us in the room, that's great. Or if you want to come and speak to us afterwards, that's great as well. Because I don't know what we're doing on time.
Or if you email in Pet Remedy, I've written a lot of stuff about this, which probably explains it a little bit better.
Yeah, so definitely. If you want to speak on a one-to-one, I've got some business cards in my bag here as well. You can get in touch and email, and we can speak to you more one-to-one. But it's up to you on that kind of thing. But great, nice to see you, darling.
Safe journey home, everybody.
Yeah, safe journey.
I hope you enjoyed the show. Go and put your feet up for the weekend.
Of course you can, darling.